I just saw this patient, 49-year-old male. He has a history of vitritis in the right eye, some yellowish retinal lesions also. He's already had an extensive lab workup, which has been negative so far. I think we need to include some atypical infections, possibly even intraocular lymphoma in the differential.
Well, good thoughts. Well, let's go take a look.
All right.
All right, Mr. Chu. So far, your labs have all been normal or negative, but we still need to be certain that the inflammation in your eye is not caused by an infection or possibly even a malignancy. So by surgically removing the vitreous gel from the back of the eye and sending that to the lab, we can often make a much more accurate diagnosis. Can you please call the pathologist and let him know to expect the vitreous specimen?
Sure.
I've got to run because I've got to babysit my nephew for this evening. So
Very nice.
See you tomorrow. Thanks.
Good day.
Let's read about the crow and the pitcher. A crow, half dead with thirst, came upon a pitcher which had once been full of water. But when the crow put its beak into the mouth of the pitcher, he found that only very little water was left in it, and he could not reach far enough down to get at it. He tried and he tried, but at last had to give up in despair. Isn't that sad, Nathan? Then a thought came to him, and he saw a pebble, and he took it, and he dropped it into the pitcher. Then he took another pebble and dropped that into the pitcher. And then he took another pebble and another and another, and he dropped them all into the pitcher. Then he finally took a last pebble and dropped that into the pitcher, and at last he saw that the water was up near him. He was able to quench his thirst and save his life. And do you know what the moral of the story is? Necessity is the mother of invention. I wish we had a better way of getting more undiluted vitreous.
Well, Paco uses cotton tips to partially collapse the globe.
Some people use air instead of BSS.
That's a good point.
What if we use Perfluoron to displace the undiluted vitreous anteriorly, where we can then easily remove it?
Oh, well, I think Hugo Mercado described the technique for PFO infusion during vitrectomy.
Right. First, detach the vitrector from automated aspiration. Attach a 3 cc syringe to the vitrector line for manual aspiration. Next, attach the PFO syringe to the infusion cannula. Then place the infusion, as you normally would. Place the superior sclerotomy cannulas as well. Before starting the biopsy, manually infuse a small amount of Perfluoron to bring the pressure up to high normal. After you insert the vitrector, begin cutting, and then direct your assistant to manually aspirate until 0.5 to 1 cc's of undiluted vitreous are obtained. Now, with the vitrector still in the eye, infuse Perfluoron manually until the pressure is normal. Then remove the vitrector from the eye. Hold the vitrector tip up so that all the undiluted vitreous in the tube flows easily into the syringe with aspiration. Once the entire specimen is in the syringe, detach the syringe and cap for immediate transportation to the lab. Then repeat the Perfluoron infusion to maintain normal intraocular pressure while obtaining additional specimens. Using this technique, we can easily obtain at least 3 to 5 cc's of undiluted vitreous. Once all the specimens are obtained, reconnect the vitrector to automated aspiration and the infusion cannula to automated infusion. Complete the vitrectomy, then remove the Perfluoron. Send the vitreous cassette for cytology or other studies, with a heads up to the lab that the cassette contains Perfluoron as well as diluted vitreous.
Well, the lab was very happy with the amount of undiluted vitreous that we got.
Very good.
And the initial tests were all negative. I mean, there was adequate specimen for all the PCRs, flow cytometry, cytology. But this morning they called me, and the PCR for toxo was positive.
Oh, wonderful. That's great to make a definitive diagnosis. So fortunately, we got a great specimen and we were able to diagnose infection with toxoplasmosis. Fortunately, we can start you on a specific treatment right away.